Welcome to GenX Adulting, and today we are going to discuss pelvic organ prolapse. I'm going to share my own personal journey so far with that. I have pelvic organ prolapse, and I think it's important to discuss it because, again, as a Gen X woman or girl that grew into a woman, no one discussed this with me. I knew nothing about this until it happened to me. It's such a disservice to women. I do know that the younger generations are way more educated on pelvic floor therapy and keeping the pelvic floor strong, especially after childbirth. But all that we were told to do was Kegel exercises, and then you should be good to go. And for anyone who doesn't know what a Kegel exercise, it's basically where you kind of tighten up your vaginal area and you're supposed to hold it for kind of as long as you can, I think, and then release. And you do a series of Kegel exercises. You can do them in the car, anytime, sitting. You can do Kegels anywhere, anytime. And we were pretty much told, do Kegels and you're good.
Is there any merit to that? Because I do recall you being told that and you're like, oh, I'm going to do my Kegels. Is there any merit to that, or is that just nonsense?
No. I think Kegels are definitely part of pelvic floor therapy, but they're just one part. And so we were given just one tool, and we should have been given a lot more tools. One of them being educated and not going into so many things ignorant, especially after having children. So I'm going to do my part here. And just like we talk about very openly about relationships, marriage, parenting, menopause, perimenopause, I think we should be discussing pelvic organ prolapse. And going through it myself, I felt it was important to share my story.
I have two questions off the rip that you can weave into the conversation. One is, how did you find out about it? And I'm sure you're going to go into that. And is there anything they could have done when right after delivering, say, our last child or any one of our kids? Is there anything they could have done that would have helped prevent it and, deal with it then, as opposed to the journey you're on now? Yeah.
So preventative care would have been pelvic floor therapy. I personally think that every woman who has a child vaginally, I don't know about cesarean. I can't speak to that. So I'm speaking of vaginal birth, should automatically receive pelvic floor therapy. It should be automatic. And maybe it is now. I don't know.
Yeah.
So maybe some of our younger listeners can pipe in on that. But I can speak for Gen X women. No.
I do recall Grace talking about it. One of our previous guests around there's something more proactive.
Right. No, she did. She spoke about it, and she's a Gen Z. She's the oldest Gen Z. So I think they're going to, those moms are going to change the narrative for sure. But for us, again, it was do your Kegels and take care of the baby. And that was pretty much it. I mean, don't even get me started on, there was no discussion really of postpartum depression and all that, but that's another episode. But I'm talking about as far as pelvic floor therapy, Gen X women weren't told anything about it. And I know boomer women weren't, so I don't need people coming in talking to it. I know women before us were not. It was not discussed with women before us. It was not discussed with us. So speaking as a Gen X mom of three vaginal births, I never heard the words pelvic floor therapy.
And we actually have 3 kids who range in age. And even on the last, right? Nothing was said.
Yeah. So we have 97, 2000, and 2010.
Yeah.
So even though they're all Gen Z, I've got the youngest Gen Z and I've got the oldest Gen Z, and then one kind of in the middle. And in all those 3 vaginal delivery experiences and all those years that span, no one said anything about pelvic floor therapy. So again, this could be something that's changing. I hope so. And like you just referenced Grace, a previous guest. If anyone's interested, go check out her episode. She talked about it like that was just normal. Like probably how people said to me, do Kegels. Now they're saying pelvic floor therapy. I don't know. Or maybe she may just be, very proactive of her own health and has searched that out. But for me, and for I think most Gen X women, pelvic floor therapy was not discussed.
Well, I think it's not just the younger generation of women, but it's an evolutionary thing, right? Women do get better health care today than they do 30 years ago. Now, you still probably, I don't want to go down that whole rabbit hole, but it's an evolutionary thing where your issues will still, get tended to a little better than they have before.
Because women are going to talk about it.
Yeah.
And because Gen X women are talking about it especially. So what's happened here is as Gen X women are hitting midlife, we're talking about all the things and we're changing the narrative. So because we're going to shout it out, and then the younger generations certainly are shouting it out. So I think the combination of us bringing things to light, or at least getting it out there, and then the younger generations just kind of demanding it in some ways because we've raised them that way. I think that there's going to be a complete change of narrative, but it's going to be because of women. It's going to 100% be because of women. There's no question. This all kind of started, yes, when I had children, but I didn't know. So having children and then lack of pelvic floor therapy is really the root. But then during perimenopause, during my 40s, I developed fibroids, or I had always had them, but they started being symptomatic in a way of the symptoms were bleeding. I just was bleeding all the time. I was having like 2 periods a month, sometimes like 10 days of bleeding each time or longer, horrendous cramps, like it almost like if you're the beginning of labor pain cramps. Now, when I was younger and had my period, I had horrendous cramps. But then after I had children, my cramps lessened significantly. But then once I hit perimenopause and I had these fibroids and the bleeding, the cramps were horrendous again. And it did affect my quality of life. I would feel weak. It made me anemic at times. And I would feel like I didn't have energy, or I'd be bleeding so heavily that I didn't feel like I could go and do things like for any length of time, because I was afraid I was going to bleed through my tampon. And even though I could bring extra tampons with me, there was always that feeling of you could put a tampon in and within 30 minutes, you could be gushing blood again. And if you're out, like I had situations where I bled through my pants, and that happens to young girls, teenagers, but as an adult woman, that was shocking to me to be dealing with that, where all of a sudden I would have this gush of blood and I'm in a store and I'm like bleeding through, right? And I'm rushing to the bathroom, and the type of bleeding it was also had clots. So there were times it was like it was almost like a murder scene. It looked like it was just bad. It was it would be like you're cleaning up a murder scene almost.
God.
That's how it felt, right? And imagine being in a public restroom.
I was going to say you're at Publix and just
yeah. And that's what women can go through, whether they're dealing with fibroids and bleeding or just horrendous, horrible periods. You can end up in a public restroom and feel like you need a hazmat suit and gloves because you're bleeding everywhere. And it's horrendous. It's absolutely horrendous. So this went on for a long time. And it got to the point where I said to my gynecologist, I can't do this anymore. It's affecting my quality of life. It's affecting me participating in life. I don't feel well and I don't have energy. My blood count was low. Like I said, I was anemic. She suggested an ablation, which is where they burn the lining of your uterus. They cauterize it. So you would still ovulate and your body would still go through all the normal stuff, but you would not shed a lining of a uterus, which is what when you menstruate, that's the blood. I still don't understand how that works, but that's what they do. I'm just curious, like, so when you ovulate, like, how does your body like shed if you're ablaze? So I never looked that up. I'm sure somebody knows. There's a risk though that would work, but then like a couple years later or 3 years later or 5 years later, it would stop working.
Do you know, because you've piqued my curiosity there. The fibroids, do they open additional, say, holes in your uterus, which then causes the additional bleeding, and then that's what they would cauterize? Or would it be like a full-blown, let's cauterize you and seal you up? Because that doesn't make sense either, right?
Yeah, so I don't know. I don't know how I think I just would have, so fibroids are like benign tumors, right?
Mm-hmm.
So that's how I describe them. That's how I understand them. If I'm wrong, someone definitely correct me. But so they would have still been there, but I would not have been bleeding anymore. So I still would have had the fibroids in me. And that's where it's like, would my body continue to function? I never went down that road, so I didn't research it. You can have fibroids removed.
Yeah, I remember that.
You can,
as an option.
Yeah, you can have fibroids removed. Well, that wasn't an option for me. They didn't give me that option, but I know you can. The only options I was presented with was ablation. And then I didn't want to do that because there was a risk of, if it doesn't work and it stops working after like 2 years, 3 years, 5 years, you're going to have a hysterectomy. So I went and I got a second opinion, and he right away was like, and I love my original gynecologist, but she was very much pro ablation. I went for a second opinion, and he was like, no, let's just get this out. Let's get this out of you. Like, why? Let's just get your, and I still don't know.
Go right to the hysterectomy.
Right to the hysterectomy.
Yeah.
He's like, let's just stop this.
I feel like, actually, now that you say it, you could have, the fibroid removal or suture or cauterization or whatever was an option, but it was like, that's a terrible option. Let's skip right past that. And that's why I don't think you're an expert in it, right? Then you did the ablation, it was officially recommended. And it was like, that doesn't sound great either. And then it was to the hysterectomy. So there was sort of that bump down in choices. From what I
don't remember them presenting me with an option to even just have the fibroids.
Well, I think because it was they were too far.
It was too far gone,
it was it's not worth it.
Because, so I went with the hysterectomy. Because I kind of thought, because when you've been bleeding that long and going through the subtle trauma of bleeding out in like public places and in your own home and not being able to function, you kind of get to the point where you're like, that sounds great, the ablation, but I don't want to be back in this place. I don't want to do this again. I want this done.
Well, there's an age component too, right? It's not like you were 25 and this is happening.
Right.
It was when we were done having kids.
This is true. So if somebody was younger and they still want to have a family, ablation totally makes sense.
Yeah.
I was done with my uterus. I'm 54. And so I would have been, this was in 2020. I'm going to be 55. Oh. So this would have been 5 years ago. I was 50. And so it's obvious that I was not having any more children. And so they could just take the uterus. So I chose to go with the hysterectomy, and I do not regret that. Now they took my uterus, my tubes, and my cervix. They kept my ovaries. I said, only take my ovaries if it looks like there's issues with them. But I wanted to keep them because I didn't want to be put into medical menopause. And
they were still functioning.
They were still functioning.
Still producing hormones at that time. So you didn't want to just jump right into an unnatural path, I guess.
Right. Although now that I know about HRT, I do wonder if I would have been taking some hormone replacement during perimenopause, maybe some progesterone, if that would have helped shrink the fibroids. I look back now because I've learned some things, and I wonder now, I don't know, but I wonder if I could have taken some HRT, if that would have helped with managing the fibroids and the bleeding. I don't know.
Yeah.
But I still didn't want to be put into medical menopause. So and even though I had some PCOS, polycystic ovarian syndrome, meaning I would get cysts on my ovaries, and there's other stuff that goes along with it. I told him, if everything's fine, leave them. And he didn't feel what he saw that they needed to be taken out. So I kept my ovaries.
And 5 years later, they're still fine. I mean, they're not functioning anymore, but they're not problematic.
Correct.
Yeah.
And I have gone through for annual internal ultrasounds every year to make sure that they're not problematic. So I showed cysts. I continued to show cysts on my ovaries up until a year ago. But I would go in, they'd see it, they'd have me come back 2 months later, and it would have ruptured on its own. But it's mainly to make sure that it's not leading to ovarian cancer. Mm-hmm. So anyways, had the hysterectomy. I was happy with that decision. That was life-changing. For anyone that's going through that, my biggest piece of advice is rest after the surgery. There is no rush to start getting back to doing all the things. You can only heal once. I can't tell you how many women's accounts I read about that they started doing things too soon and they ended up back in the hospital to repair the damage from doing things too soon. You can only heal once correctly. Stop doing the things, insist on help, and even if you don't have family, like reach out to friends and be like, I need help for the next 10 days. You shouldn't be doing anything at the minimum 10 days.
Well, I was just going to ask you that. Do you recall the length of time, the recovery
I think
time?
For me, I was down for about that long or so, like where I wasn't doing much. And then for another week or two, I still was taking it pretty easy. And then even now, I still won't lift certain if things are too, although I've gotten over, I started lifting pretty heavy stuff. But it took me a long time. Anyways, life was fine. Everything was good. I rested. I healed correctly. Didn't have any issues. Didn't have any bleeding. Everything healed up. Sex life was normal. Like having the hysterectomy didn't affect that. And then I want to say 3.5 years in, I noticed something different. I was in the shower and I was like, I feel like something has fallen. And in my perineum area, like it felt lower. So the perineum area, probably perineum, the perineum area felt like it had gone down a little bit. And I was like, that's weird, but I didn't know about prolapse.
That's weird.
Yeah. So I was just like, maybe this is just aging. And just like so many women are my age and older, we didn't say anything to anyone and I kept it to myself. And I was just like, I don't know what this is totally, but I didn't know how to even approach it. And so I think I finally, at my gyno appointment, I said to her, I think I have prolapse. And she's like, oh, yeah, maybe a little bit. Like she didn't really take me totally serious. She's like, yeah, maybe a little bit. And still didn't say anything. Still didn't say like.
What? Well, you said something, but what else would you say? Be like, hey, this thing fell.
No, nothing. Yeah, I just said I feel like I have some prolapse going on. And I might have said like, I feel like something's gone lower. And she's like, yeah, you're a little weak down there. Yeah. Something like that. But even then it wasn't like we should get you going on pelvic floor therapy. Even then.
How long ago?
That was like a year and a half ago.
Okay.
Maybe almost 2 years ago now. Probably almost 2 years ago. And then every time I would go in, I would bring it up. Like, I think I have some prolapse. Yeah, you're kind of weak. And that was it. And finally, I said, I want to go to someone to have a specialist to have this looked at. And she was like, okay. And then she recommended someone. And so I went to a urogynecologist. And that's a whole thing. I had no idea what to expect going to a urogynecologist. I had no idea what they were going to do. I thought I was just going in for like an appointment to talk about what's going on. What really drove me to finally be like, I want to go see someone is I just felt a heaviness more and more. And eventually it felt like something was kind of starting to press out of my vaginal area. It's not like something separate from me was coming out. It was almost like the tissues were being pressed out.
Well, I think we talked about that's like not a like a hemorrhoid that's popping.
It's not like a hemorrhoid. No.
You're saying you had additional pressure on that area.
It kind of
felt like,
yes.
Yeah.
It's like almost like weight was on that area. So the inside was being pressed out. But it's not like a thing that was coming out, if that makes sense. It's
Going back to the gynecological review, I guess, maybe, I don't know what you call that. Your gynecologist, and her saying, oh yeah, you're a little weak. What was that? Like, how would she know? Is that during like a normal exam type of thing? Okay.
Yeah, like where they use the spectrum. Now, once I had a hysterectomy, I didn't have to have pap smears anymore, where they take a swab of tissues from your cervix with like a long Q-tip. They put the speculum in, the metal thing. They open you up.
I have no idea.
Yeah, I know. I'm telling you. They stick a long Q-tip, take tissue off your cervix, and they send it in for testing to make sure you don't have cancerous cells. That's why they do it. And then they do a visual to make sure everything looks okay. For me, it became just a visual. And then they do insert sometimes a finger to feel the inside part of your vaginal wall. And that's when I think she was like, you're weak.
Okay.
She could feel that that area was probably very pliable, if that makes sense. It wasn't
I'm almost equating it to like, if I flex my bicep, there's, you get a little tighter.
Right.
Whereas if you don't, it's
right.
Is it almost like that?
I don't know when the inside of my vaginal wall. I think it's like it probably felt.
She knew. She's a doctor.
It had more give probably than it was supposed
Wasn't
to.
as firm or tight or strong.
And so in the perineum area, it was probably very weak. She could feel it was weak. That's what she meant. She could physically feel, okay, there's probably more give here. And that's where I'm like, and maybe by that point, I would have been too far gone for pelvic floor therapy. So there wasn't a point in even recommending it. I don't know. But
there was almost no recommendation. It was almost like, Yeah.
And I don't know. And I like her a lot. So I'm not faulting her. But I think it maybe just is a cultural thing in that the medical industry does not focus on pelvic floor health of women enough.
I wonder.
At all, which blows my mind, because our bodies are being used to produce the next generations. If it wasn't for us, life would stop, right? We produce the next generations out of our bodies. Wouldn't our pelvic floors be something that the medical industry should prioritize in women? But it's like just now, really, where it's normal that people are talking about it.
Well, it's still not prioritized by the medical industry. I think it's driven by women.
Yeah.
But it's like all healthcare, both men, women, children, seniors, cancer patients, whatever. You have to drive your own health.
You have to be your own advocate.
You have to be your own advocate. Yeah.
Especially as a woman.
Yeah.
Because so many.
We don't have this stuff you're talking about as guys, obviously. Yeah. This is not a thing. This is some wild stuff.
Well, no, and so many studies have been done on men too, and then just those results are just transferred over. Well, it's good enough for men in other areas of medicine. So it's a whole thing. But so I went to the urogynecologist, and it wasn't just, hey, this is what's going on. It was, oh, while you're here, you're going to have a procedure done. It was called a video cystoscopy. I think I'm saying it right. Cystoscopy. It's where they put a camera up your urethra.
Oh, God.
To look in your bladder to make sure there's no tumors. She had to clear that first. So they spend time getting a baseline before they do anything.
Oh, interesting. Is the concept there? Maybe if there's a tumor in your bladder, it'll create the pressure that may be a false indicator of the prolapse?
Possibly. Or let's make sure we're not dealing with a bigger issue like cancer.
Yeah.
They have to rule that out, basically.
That cannot be comfortable.
Not at all.
Yeah.
So they do some lidocaine on the outside, lidocaine gel.
Yeah.
No, it's like having a catheter put in.
That's insane.
Well, no, it's like.
Well, it literally is. It literally is.
I think how it went is the catheter went in, and then she put the camera through the catheter. So okay. I think that's how it went. I don't know. I was literally Like when I made the appointment, here's another thing. No one said, by the way, there's a chance you're going to have this procedure done at this first appointment. So I'm thinking we were going to sit in chairs and talk. I'm now laying back like I'm at a gyno exam, looking up at the ceiling thinking, okay, what the fuck? So breathing, because it's a lot of that. For women in gyno appointments, there's a lot of pain. And just like with having birth, there's a lot of breathe through it. It's like, okay. Mind you, if this was men, there would be pain medicine. There would be. I know there would be. 100%. Anyways, no. So I did. So they did that. It was all clear. And then I don't know if it was through that or her exam. I'm trying to remember now, but they came to the conclusion that a lot of prolapse can be going forward in your body, or it can be going backwards or coming straight down. So for me, it's going back. It's called like a rectocele. I'm probably saying it wrong, but it's where it's a prolapse of the posterior compartment. So the anterior compartment would be where it's going forward towards you. Mine's posterior. So I'm getting more pressure on my bowels. Whereas for women where it's anterior are getting more pressure, I think, on their bladder. And they I think, end up with incontinence, or where they're leaking urine, or they pee when they laugh or cough or sneeze. I don't have that. So hold on, I have a thing here. It's called stress urinary incontinence. I don't have that. I'm not leaking urine. So a lot of times when you say, a lot of times when you say prolapse, people automatically think it's related to bladder and you're becoming incontinent. And that is true in some situations, but in my situation, that's not it. It's going backwards. And that's why I felt like something in that perineum area fell, because it's leaning back. And then the way it was also described is from the middle, it's kind of going down. So where it was like flat, the middle part of my body is now caving in on itself a little bit, caving in and then going back as opposed to forward. And so that can cause issues with like constipation, right? So for me, like I have to have celery juice every morning. If I don't, I am constipated. Like I'll go, but I'm not, like, it's not how it should be. Or I have to have like smooth move tea. And I didn't
some type of laxative.
But I won't do like the pills, but a natural laxative, right?
Yeah.
Fiber.
Yeah.
I thought that was just maybe like perimenopause, because that's a symptom of menopause, and it could be also.
Well, I think that's the challenge, right? Because you've got this whole biological chemistry lab experiment ecosystem happening.
Yeah.
And there's a lot of crossover. Hell, at least from what I've learned, right? It's either menopause, perimenopause, just some random shit from childbirth. Now the prolapse, right?
Yeah, exactly. And so I didn't totally understand it's physically affecting that. So that's part of that too.
I do think that's an important part, though, you just brought up, especially obviously for any women listening. There's the anterior, the posterior. I think there's the straight down. And I bet they all present themselves with you touched on it. They all have slightly different symptoms. But they could ultimately be the same thing with the same resolution.
Yes. And it depends on the severity. So I think it's graded like 0 to 5, and I'm a low 4.
Yeah, I was going to ask you that because you'd mentioned that the other day when you're looking at your options.
My prolapse,
And that could be when you go back to like when you were doing the gyno exam and she's like, it's a little weak. Maybe you were stage 2, 0 or 1.
Or
it and then the next time you're you fast forward, now you're 4 and it's like, well, shit.
Yeah.
I can't imagine 5, right?
No. So now okay. So I leave that appointment and not knowing what my results.
And this was like a year ago, or no it wasn't that long ago,
this was in
right?
May.
Yeah. Okay.
May. And then they said, okay, now your next thing you have to do is a urodynamic testing. again, I had never heard of this before in my life. And I couldn't get into that until, I want to say August or something. It was like a few months. And so urodynamic testing is interesting. And maybe we'll put a picture of the chair I had to sit in on the video part of so people could see. It looks like a torture device chair. It's almost like if when you lean back and you put your legs in the stirrups for an annual exam, but you're sitting straight up. So your legs are in stirrups, kind of knees up. You're sitting on a chair that's open, has a cone open. And then there's like a container underneath there, right? It's like medieval, I swear.
I bet anything it was designed by a man, by a male
there is
engineer.
No question.
Yeah.
Okay. So I walk into that room and look at that chair and I was like...
I bet anything they have a nickname for it, right? The electric chair in Florida, they call it Sparky. I bet there's some random...
I can't even... it's one of those things women go through where we're just like, really? So they say arrive with your bladder pretty full, which is interesting because then you sit in there and they fill your bladder. Hold on. I actually have it here. I want to say it correctly.
Wait, so you show up full bladder. It's like, all right, like drink a gallon of water.
Fairly full, like comfortably full. Okay. But then so then I think what they do is, if I remember correctly, I think they had me go, I think, and the thing underneath was measuring how much I went just on my own. I think that's what it was. And then they did, it's called a filling cystometry. And they put a catheter into my bladder and they filled it with sterile water. I'm reading this because
it sounds like a vaginal enema.
They filled it. Yeah. And it says this measures how much your bladder can hold, your sensation of fullness, and how your bladder muscles behave. After your bladder is filled, you will be asked to urinate. This test measures the flow of urine and the pressure in your bladder during urination. You will be asked to urinate into a special toilet that measures how much and how quickly you urinate. That's the thing that was underneath me. Sometimes small electrodes are placed near your pelvic floor muscles to measure the electrical activity in these muscles as you try to hold and release urine. I had that. They put the electrodes on me. So I had that. Now, during it, there's a picture, and maybe we'll put the picture up, but it's like the sensation stages, like you don't really feel like you have to go. Stage 1, kind of feeling like you might have to go. Stage 2, stage 3 is like, yeah, I have to go. And stage 4 is like, I'm going to pee my pants type of thing. And so she basically filled, I don't know how she measured how much to fill me up. Maybe until I said, I don't know. I can't remember now, but she filled me up and then I just had to hold it and tell them when I was at each stage. And then...
Well, so there's some arbitrary thing that they're filling you up and you're like, oh, I'm a little full. Then you get to that final phase where you're like, I'm about to piss my pants. That kind of thing?
I think it was that. Yeah. Okay. And I was supposed to say, and then I think they stopped. And then they wanted to make sure that once they do the prolapse, that I'm not going to be incontinent, meaning is the prolapse kind of like when you...
maybe it's working.
What do you call it when you do to a hose?
You crimp it?
You crimp it. So is the prolapse actually crimping my bladder? And once they fix it, will I be incontinent? They wanted to make sure that they're getting a true read on my bladder. So she actually would like put an instrument inside of me and like lift the prolapse during this procedure as I'm sitting in this chair. And then...
Could you feel it like rolling around inside your body, or is it more like almost like
it's just pressure. It's just pressure. Okay, yeah. And then I would pee and then stop peeing. So, and then she, with the electrodes and stuff, she would gauge, was I able to stop peeing on my own or not? And we did that a few times because they're trying to make sure the prolapse isn't crimping the bladder. And so through that testing, they did confirm I don't have incontinence. I can stop. Now I can't stop, like, you don't know, but like women, when we have to go pee in a toilet at the doctors, they give you a wipe and they want you to pee like for a little bit, like 2 seconds, 3 seconds, and then take the wipe, clean yourself, and then pee in the cup because they don't want any outside bacteria going in the cup. I used to be able to do that no problem. Not anymore. That's not happening anymore. So I don't have incontinence, but if I start, I'm not stopping. So when we were doing it, it was weird because I would maybe I didn't pee. She had me just bear down. I think she had me just bear down and then not bear down. And that's what it was. And I think during the bearing down, I didn't have any urine leakage. So they knew, okay, you're not incontinent. So I was just.
What is
bearing down?
Women will know, but I'm the only guy in the room.
Right.
What the hell does that even?
So like
to me, that means you're pushing.
So bearing down would be almost like if you're trying to push out a bowel movement or a baby. You've heard that with labor. When you go to push a baby out of your vagina, you're supposed to use the same feeling as if you're having to push out a bowel movement.
And then the bowel movement cancels the urination event?
No, just so she's having me bear down to push my pelvic floor muscles down. Well, to make sure that when I bear down, I'm not leaking urine. I'm not peeing. So she's making sure that.
All right, women will understand.
Women will understand, yeah. So through that, they confirmed I don't have incontinence. And then they were like, okay, now go ahead and pee. And they're all in the room. I couldn't pee with them in the room. I just sitting in that chair. Mind you, my legs are spread in stirrups. Okay, so my legs are up on, like, not in stirrups, like over this contraption. And I'm supposed, and I'm in a public open room, and I'm supposed to just now relax and pee. And they left pretty soon after because, it was pretty, I could tell it was normal. A lot of women, I think, have issue. And I had to just like focus and be like, you have to just be, I've never peed like that in my life, where I'm just sitting there spread eagled in a room, air conditioner blasting. I can hear people in the hallway talking and I'm supposed to just pee. It felt humiliating, but it wasn't meant to be that way. But it just felt, I was so vulnerable. And I was like, I cannot believe this is happening.
You got to get into like camping or like concert mode or something.
Yeah, but even then you're bent down. It's just different. I was like leaning back.
Oh, true. So it wasn't even like a natural pose.
No, I'm kind of back a little. I was kind of back. Weird. So I wasn't even like sitting up.
Yeah.
So I finally peed, but I did. So they did say that I'm probably not getting rid of all the urine, and the Prolapse should, when they fix it, should help with that. So we went through the urodynamic testing, got all that done. And
this is like some medieval shit, really.
It felt that way, but it's until they figure out a different way to do this. Shook off the electrodes.
And in the beginning, what you were describing, I was like, why the hell did they need to do this? Just fix it. But it makes sense the way you described it.
They have to check everything. Yeah, like in the beginning, the first thing was to make sure we're not dealing with bladder cancer.
Yeah.
The second thing is to make sure she could fix everything. And then I'm incontinent. So if that's going to happen, she's like, I want to fix that while I'm in there. Yeah. So then we talked about what are my options, and women have a few options when it comes to prolapse. One of them is, it's called like, I think a pessary. It's where you put it up inside of you to like hold the prolapse up. It's something that you would get fitted, and I think you would have it it's not like a diaphragm concept, but kind of, I think. And I think you would have to have it replaced. Like you'd have to get a new one. It's like an object that would hold you up, I think. The next one is to use your own tissues to lift everything up. So kind of like cut and stitch, I think is what they're talking about, and hope that your tissues will heal up and hold you in place. The next one is to use like a mesh to lift everything up, and it attaches to the back of you, almost like near your tailbone. And then in extreme cases, for women who are no longer sexually active in their life at all, they'll just close you up, which I had never even heard of before. Wow. That part of your body.
Yeah.
Because if you're
just let it go to the floor.
but it'll
it.
stop.
Yeah.
It'll stop, right? So
what you're describing then, it's holding in your abdominal cavity, right?
Your vaginal, your pelvic organs, your vaginal, your vagina, your uterus, if you still have one, your rectum.
Okay. All right.
Like that whole area. It's
not your intestinal cavity and your stomach. That's like
probably
up a layer.
No. So it actually says it. What is pelvic organ prolapse? This condition refers to the bulging or herniation of one or more pelvic organs into or out of the vagina. The pelvic organs consist of the uterus, vagina, bowel, and bladder.
Okay.
So it is the bowel.
Yeah.
Pelvic organ prolapse occurs when the muscles, ligaments, and fascia, which is a network of supporting tissue that hold these organs in their correct positions, become weakened.
Mm-hmm.
So symptoms include a heavy dragging feeling in the vagina or lower back, feeling of a lump in the vagina or outside the vagina, urinary symptoms such as slow urinary stream, a feeling of incomplete bladder emptying, urinary frequency or urgent desire to pass urine, and urinary stress incontinence. Bowel symptoms such as difficulty moving the bowel or a feeling of not emptying properly or needing to press on the vaginal wall to empty the bowel, or discomfort during sexual intercourse. But yeah, the pelvic organs are the vagina, the uterus, the bowel, and what was the last one I said? The bladder, which I didn't know that. I didn't know those were considered I didn't know which makes sense. Duh. The rectum is connected to the intestines. That's part of your pelvic floor.
Yeah, but we all oversimplify that. We picture it as being like the end of the tube type of thing, and it's just there.
It's all connected.
Just there. Yeah, and it's not like free floating. This shit sounds like it's all free floating, right? It's not.
I think so because there's nothing that's like holding it. So then when you so I did ask, like, why did this happen? Like, she said you've had 3 vaginal births, and that's the main reasoning. And I asked, did the hysterectomy have anything to do with it? And she said, maybe a little bit, because without the uterus there to maybe kind of hold some things up. But she said it's not the cause. She's like, it's just all kind of went in together. So she says it's mainly from the 3 vaginal births.
Yeah.
So again, pelvic floor therapy after, and if you're predisposed, like genetically, I don't know, because none of the women in my family have talked about this. So I don't know, because they say like 1 in 3 women experience some form of prolapse, but only 1 in 9 women will need surgery. I need surgery. There is no fixing this without surgery. And so
wait, what were those stats again?
1 in 3 women have some form of prolapse, but only 1 in 9 will need surgery.
It's actually a high percentage.
Yeah.
Like 1 in 3 women will have prolapse, and out of those, 1 out of 9. It's a lot of women.
I think so.
Yeah, mathematically, it's a lot.
Yeah, no one's talking about it.
It's interesting.
So for me, because of my age, I'm still young and still, because God willing, have years still to live here, right? I hope. The mesh is what she recommended to bring everything up, because there's a concern if I use my own tissues, we may be back in doing the surgery when those give out again. And then I'll just need a mesh. It's kind of compared to the ablation. If that fails, I'm going to need a hysterectomy anyways. If the using my own tissue fails, I'm going to need a mesh anyways. And then I did go to get a second opinion. I did not with my hysterectomy, but I've learned in my old age to no matter what you're having done, get a second opinion. And I went to a man, and he was recommended to me by the man who did my hysterectomy. The doctor who did my hysterectomy doesn't take our insurance, so I couldn't go to him even for a second opinion, which was unfortunate because I liked him. He recommended this other doctor. I like that doctor a lot. He agreed with what she was saying. He gave his own diagnosis of how it should be resolved, and it matched hers. So then I felt, okay. Like he felt, yes, mesh.
Well, I think you also researched it, right?
Yeah,
Googled
but
it,
yeah.
AI'd it, whatever.
Yeah. Laparoscopic robotics, which was my hysterectomy. It's where they do small cuts in your abdomen. And they do it robotically. And I don't know anything about that. But he even said that he could probably use the same scars for my hysterectomy scars. I haven't even talked to her about that. So, I'm going to have that done. I'm going to have the surgery done. So so where I'm going, it's all women. It's a women's center. She's obviously the director of the center, not obviously, but she's the director of the center. But then her whole staff, I think most of her staff is women. There are men there, but it's mostly women, very female centered. She did say to me towards the end of our appointment, do you want me to just remove your ovaries so it eliminates any risk of ovarian cancer in the future since they're no longer producing hormones? And I was like, yeah. And I said, how do you do that? She goes, we just cut and cauterize. And then you don't have to. And I said, I thought once they are done, they just kind of shrivel up and you don't have to worry about ovarian cancer. And she said, no, you still have to worry about ovarian cancer. So she added that. And then she did say when she was examining me, she said, do you feel loose during sex? And I made a joke like, I've had no complaints from my husband. And I laughed, but they didn't laugh because they're being serious and they're women centered. So they don't give a shit about you.
Yeah, that's hilarious.
And so then I was like, well, yeah, it's looser from having children. And she's like, do you want me to she goes, I'd like to fix this up. Like she's going to do I wrote it. It's a I'm going to say it wrong. Perineorrhaphy. It's a tightening of the perineum. So she's going to do laparoscopic robotic, I believe, for the prolapse and the ovaries. But then she will be working on the outside of me. And she said basically she does like a cut and then sews everything up and restructure it. So she's going to kind of like tighten up the area, close it up more. Basically, from the outside, give me more support. You know what I mean? Like she's going to close things up a little bit to give my pelvic floor areas more support. So in the healing, it won't just be internal healing. It'll be external, which will be interesting because I didn't deal with that with the hysterectomy. It was all internal healing. So this should be interesting. Now, what's funny, not funny, but a few days ago, I got a call, last week, from her
one of the office
nurse
girls.
practitioner. Well, no, this was from her nurse practitioner. She has more of an official name. I feel bad, but saying that even though my insurance has deemed everything medically necessary, they are denying part of it. And I didn't know what part they were denying. So she's like, I have to ask you some questions. So she just asked me stuff like, has this affected your quality of life? What do you feel anything kind of coming out? Do you feel a heaviness? Like just kind of reiterating like my symptoms. And then she goes, okay, I'm going to go now meet with the peer-to-peer review board and fight for you. And then a few days ago, I get a call from someone at the hospital. And all she said was your surgery was denied. Your insurance denied your surgery is what she said, which completely upset me. And I was like, what do you mean? And she's like, yeah, they're not going to take your uterus. And they denied taking your uterus and ovaries or something. And I said, I don't have a uterus. And she's like, well, they denied taking your tubes and ovaries. And I'm like, I don't have tubes. And I said, could you pull up my information so you know what we're talking about? And then she pulled up the codes and she's like, yeah, so they're denying this code is ovaries and then the other one's surgery. And I'm like, so are they denying my entire surgery? And she's like, yeah. And so I said, can you have someone call me that knows what it's like? She was just spouting information in such a way. She was ignorant to what she was saying. And it was so upsetting to me because it sounded like you can't get your prolapse fixed. And then the nurse practitioner I'd spoken to last week.
Well, you're underselling it a little bit because you did try to find out from her, but she had no clue what the hell she was doing.
She didn't know.
And I mention it because it goes back to, you have to advocate for yourself.
Yeah.
Because you were ready to, if you would have just been like, oh, okay,
Yeah.
and then walked away. I don't know what, the outcome would be different. Instead, you kind of lit her up pretty good, but rightfully so. I was sitting here in the next room thinking, oh my gosh.
Yeah, I wasn't like mean to her.
Not at all. It was business.
It was business. Like I need to know what's going on. But I was, just to be clear, I wasn't like boomerish with her. I just was like very.
You were respectful.
I was respectful, but I was like, no, we're finding out, because you're right. If I was a different personality, I would have thought my entire surgery was canceled.
Yeah.
So again, be your own advocate. Ask questions. My dad was a doctor. They're just regular people. Don't have this whole like they're a god complex with them. You have to ask questions of these people. So I said, could you have someone call me that knows what I'm doing, about my case? And so the nurse practitioner called. I actually, there's a portal and you can message them. And then I messaged her people and I said, look, this just happened. Could someone please call me? And so she called me and she's like, I don't know who called you. Like, she was flabbergasted over that. And she goes, but we did have the peer-to-peer review, and it was a man, and he wouldn't even tell me his name, and it was a doctor, and he denied it. And I told him this.
Denied what?
Well, that's at first didn't know. And she's like, he wouldn't budge. And I'm like, wait, what is he denied? What's being denied? Is it my whole surgery? And she goes, no. The prolapse is good. And I was like, okay. I'm thinking, okay, fine. Because really, that's all I care about. He's denying the removal of my ovaries. And they're saying we're already in there. And for her health, for a woman's health, like, justify why we can't remove the ovaries. And he's just felt it wasn't medically necessary.
Wasn't he? But he was a GP,
so
right?
Towards the end, she's like, are you a specialist in urogynecology? And he's just a general practitioner, like a primary physician. And she said, I'm going to appeal this. And he goes, you can appeal it. Because when she asked his name, he's like, I'm not giving you my name. You can look it up on the file. And it's just offensive.
What a dick.
It was such a dick, And,
honestly, unnecessary.
Unnecessary. I think if she would have been talking to a female doctor, this wouldn't have happened. I
was just about to say, I don't think it was a guy male versus female. I think he's just an asshole. He's had whatever, maybe having a bad day, just a dickhead, whatever, but that's just human.
I don't know. I think that when it comes to stuff like that, though, it's easier for men to
1,000%
disassociate about certain things because they can't relate
to
it at all.
But with half a brain knows medically cancer is a cellular event. Why leave things in your body that are dying or dead and just sitting there? That's a potential landscape to go attack. And ovarian cancer, again, you don't have to be the smartest person, but it's one of the most lethal, right? You don't want to get ovarian cancer. The survival rate's not great.
Right. And I think that's why. So then she said, we're going to appeal to a specialist, and Dr. my doctor is going to go head to head with them, I think, directly.
Mm-hmm.
So they're determined. So I said, listen, I appreciate that you're fighting on my behalf. Thank you. Because honestly, I'm more worried about the prolapse, but I would love to have the ovaries removed too. And I love that they're fighting for me.
Yeah.
It really means a lot. So, I have an appointment with my endocrinologist this week because it's my regular appointment with her, but I also want to talk to her about like my thyroid and make sure everything's good. It's kind of a pre-screening before surgery. And then I go to my primary care. They have to do pre-op appointment to clear me for surgery. Then I go to the hospital and they do tests to clear me for surgery. And then my surgery is next month. And I think I'll be in the hospital, I think she said 2 nights and 3 days, something like that. And then of course rest. I'm pretty sure she said that. Rest afterwards.
I doubt it. I think she said you'll be ready to roll.
Yeah.
You don't need your husband's help or anything.
Yeah, right. But what I'm having done, I actually have the paperwork here. The actual surgery is called a Sacralcolpopexy. It's Sacralcolpopexy, a procedure to restore pelvic organ support by attaching the top of the vagina to the sacrum, tailbone, using a synthetic mesh. This aims to correct pelvic organ prolapse and improve pelvic stability. So, and then I'm having the tightening of the perineum, which I'm not even going to try to pronounce that again, but it's spelled perineorrhaphy.
You're going to need like phonics for medical terms.
I know. And then the removal of the ovaries. So, and I had to sign all this paperwork of all these, it's so involved. But I'm scared. I'm scared of surgery. I'm going to be honest. The only thing that makes me worried is I want to wake up. That's all I care about. I want to wake up. So, and I know that people get surgery all the time, but that's my biggest concern. But I know that also this could be life-changing for me in so many different ways, to have my pelvic floor repaired, which is basically what's being done. I don't think I'm going to realize how uncomfortable I've been until it's been repaired. And then I'm going to realize I've been living with this,
Do you know what are the potential side effects, or if it goes sideways? Like
so the risks are,
go ahead.
So the risks are infection, obviously. The normal risks.
No, I'm thinking like, would you be incontinent? Would you, if they fuck it up, do you get the little bag type of thing?
I mean, yeah, there's risks that, if they damage an organ, then we're looking at malpractice, even though I signed stuff. Hopefully I didn't sign that away. No, if everything goes right, this should be it. Let's say if it fails, I think I'll be really elderly. You know what I mean? Like, I think this is supposed to get me, I think, into my elder.
Yeah, you're skipping ahead to like the mesh is working. It's all good. You're like, I feel great. It's wonderful. Where I'm going, I don't think you've looked into it, and I haven't. We haven't talked about it, but it's what if something doesn't go right? Does it mean now you are incontinent, or that you can't have a bowel movement that well? We haven't looked into that. I guess that's probably something to look at.
I mean, you
got to do what you got to do, right? And
I mean, I think it gets to the point where if you have to have something done, at least for myself, too much information is going to give me so much anxiety. I don't want to go into it ignorant. I don't think I am, but all the what ifs, what's my other option? Not doing anything and living like this. And then it just gets progressively worse. And I get older. So the older you get, the more risk things are with surgery.
All right. So then some of the more inherent risks would be if the rest of your, they put this mesh in, which is an artificial thing in your body object. And the expectation is for your tissue and within your body to overgrow it, and make it all part of the happy family inside there. Right. If it doesn't, maybe those are complications. You have to go back and do it again type of thing. But either way, this is supposed to be a permanent fix.
Pretty permanent.
There could be some lifespan associated to it, but what I'm saying is you would expect to be able to have a normal bowel movement, be able to urinate, and maybe if they say stop halfway, you could probably do it type of thing. That's the expectation or the hope.
Maybe. I don't know if they can strengthen my pelvic wall to that point, but where I could stop midstream, that would be amazing. I'd be shocked. But so one issue, they did prescribe me estrogen cream, and I was supposed to be doing it twice a week, but I'm on estrogen patch twice a week. So they did have to lower the dose, and I have forgotten to do it at different times. I haven't been doing as much as I should. I'm going to start doing it regularly.
You really should.
I know. Yeah. But the holidays, it was just hard because you have to do it at night before bed. And to be honest with you, and it's only twice a week, I get that. But there were times I fell asleep I just didn't mean to fall asleep. Right. So now I'm more on it, but you do that before to make sure the tissues inside your vagina are healthy. But because I'm on the patch, that helps with that. And then they will up my dosage, and I will continue to do it, I think, for like 9 to 12 weeks after, to keep the tissues healthy. And then I think I may have to do it. This is what I thought she said, like for the rest of my life, do some estrogen cream. But because I'm on the estradiol patch, I don't know if I will. So I'll be curious what she says. But part of the reason of doing the cream, this is my point, is there is a risk that if the mesh scar tissue doesn't grow around the mesh correctly, it could end up coming through the vaginal wall. The mesh could kind of almost wear down the tissues of the vaginal wall and come through. And if that's the case, I'd have to have surgery to repair that. Again, but I think the estrogen cream is to strengthen that vaginal wall, the tissues there, so that they're strong. You know, they're not atrophied.
Yeah, yeah.
Because as you go through perimenopause, as you go through menopause, let's say, if you're not on HRT, everything dries up. And the tissues can start to kind of age and atrophy. I've been on HRT because you're kind of, I just saw your eyebrows because that has not been our experience, right? It's because I've been on HRT, everything there has stayed normal. So I think that's where the estrogen cream comes in for people that aren't on HRT.
My eye position was more at such a,
I know.
Being a guy is just such a different thing.
It is.
You guys in all this shit is nuts.
Well, because think about it, with your reproductive area, it's closed, right? We're open. So we're more susceptible to all kinds of different things. It's just we're more vulnerable. But so I've been doing the estrogen cream, but not consistently, but I'm going to be doing that. And then I'm just hoping that scar tissue grows around it and it becomes a part of my body. Yeah, I know there's a lot of mixed opinions on mesh, but it's not a sling. She said that. She goes, it's not a bladder sling because I don't have incontinence. I don't need a bladder sling. It's mesh it's like basically bringing the weight,
floor,
pulling everything up. It's pulling everything up. So, so that's next month. And so what I'm going to do is I'm going to make a video after each of my doctor's appointments leading up to the surgery and just kind of inform everyone what happened in that appointment and what was said. And then I'll talk about the surgery. You know, after the surgery, you may make a video while I'm in surgery, just keeping everyone up to date who might be interested. And then I'll talk about the recovery from the surgery and the results. I mean, hopefully they're positive and it's life-changing for me. But again, I think I'm talking about this because this needs to be discussed, because this does happen to women. And I think for a lot of women, it can be embarrassing, and there's nothing women should be embarrassed about. This is like a result of having children, a miracle we do. And I think society needs to freaking honor that and be like, okay, we need to take care of our women and this part of their body that they've sacrificed to give life. And I think pelvic floor therapy should be written like a prescription with everything else before a woman leaves the hospital. Like, here's your Tylenol, if they even do that. No, they don't do Tylenol no more. But whatever it is that they do. And then also here's a 6-week pelvic floor therapy that's covered by your insurance. It's imperative.
It's almost like we need a pelvic floor therapy guest.
Yes.
Pelvic floor therapist.
Yeah.
To talk about
If there's anyone out there that would like to come on. But I think Gen X women and women older than us, we're not served in this area at all. But I think Gen Z women and millennial women are definitely bringing it to light, and things have changed. So for a lot of us Gen X women, though, there's a lot of us that have prolapse, and it's not being talked about. So I'm talking about it. And that's kind of where I'm at with this journey so far. So I'm going to keep listeners up to date. I'm probably just going to make like camera videos after my doctor's appointments. I don't think it's going to be a studio video. And then but when we do a follow-up afterwards, maybe we'll do a short episode just talking about the whole process, because I'm sure there's going to be more interactions with doctors, with administrators, just different things we encountered with the insurance. Hopefully they approve the removal of my ovaries. We're still waiting on that. We don't have an answer yet. They're still fighting for that. That may not be something I find out until literally the day before.
Mm-hmm.
So, but I'll include the different words I said. I'll include those in the show notes. So everything I discussed, I'll write out the official medical terms in the show notes. So if anyone's going through this and is curious, you can look up all this different stuff. And for anyone younger, if you're going to have children, please insist or look into pelvic floor therapy. And that would be my advice. So did you have anything else you wanted to say?
No, I mean, it's all remarkable and just insane, quite frankly. I worry about far different things as a guy, and none of it's related to, thank God, quite frankly, I'm doing okay. I'm pretty healthy here. So none of it's related to my abdominal or reproductive or bowel or urinary function. Sorry, I mean, it's crazy.
Yeah. I mean, I think with you guys, prostate, right?
Yeah.
You guys have
But hell, even that's slow growing, and I don't even know if it's painful. You wind up finding out about it through a PSA test, and now they don't even do they do it through your blood now. It's an amazing thing. So, but even that's not painful, or compared to what you're describing. And if you do it normally, I mean, I guess from my perspective, my dad had cancer. He had prostate cancer. Then he had pancreatic cancer, which then took over his stomach. And
no, it's colon.
Or colon. Yeah. So I'm getting checked. I do the colonoscopy starting at 40, I think. Yeah. I do the PSA, so I'm all over it as best I can, and you hope the testing is effective. And then if I show up positive with something, I guess it's on. But for now, so far so good.
Yeah. But and that's more like related to cancer.
That's just aging, shitty diet, things like hereditary, genetic things, right? But environmental things, all that. But it's not what you're talking about. This is crazy. This is just women being women, and it's No,
it's a full pelvic floor repair.
Yeah.
Because like I said, she's not only going to be fixing stuff on the inside of me, she's going to be fixing stuff on the outside too.
Yeah.
So no, I'm kind of overwhelmed. I'm probably going to ask for a Xanax to take the morning of, because I have a lot of anxiety I have about it for a while.
Well, what's interesting too is the whole opioid crisis debacle shit show.
Yeah.
I'm curious to see how they handle your pain management, because they're just not giving them out as free and like they used to, right? It used to be candy. Here, take this, and now you're fucking addicted. They're managing that better, but it does come with I don't know. I'm curious to see how they handle that for you.
So in 2020, after my hysterectomy, they prescribed me
probably Oxy.
It was something.
Yeah, Percocets, Oxy.
Yeah, but I didn't get a ton. But I got I only took those the first day home, and then I switched over to Tylenol.
Mm-hmm.
But it wasn't like a huge amount, so I think it was already starting. But you're right. I bet you it'll be even less, which I'm fine. I'm fine. I don't want to get involved.
Never finished one of those prescriptions. Anyways.
No, and they use strong. Like on me, they for the hysterectomy, they use the strong stuff like fentanyl and oxy something. I mean, that was during the surgery.
Oxycodone.
Coden.
It's oxycodone, but it's
But anyways, they used all that during the surgery, so I'm sure they do that still. But as far as going home, it'll be. I don't know. It'll all be interesting. We'll document it. But again, wanting to get it out there, share it for any listeners, any women that may be going through this, or to educate younger women to help maybe prevent something like this too.
The last thing I'll say, I do think it's a remarkable thing that I think it's cool you're sharing this. It's really putting it out there, right? This is very personal. So I do think it's cool you're willing to share it, and such a personal thing. But I do think there's a huge public service benefit for other women. So I think
even if it's just one woman learns something or feels validated, or maybe gives them the incentive to mention it to their gynecologist. Because like I said, at first I didn't say anything to anyone because it's like, you don't know. You're like, what? I had no idea. I had no idea.
And I think it goes back to that whole, you've got you're a cocktail of shit going on once you hit 50s, right?
Or 40 or 40s.
Or 40s and stuff. So there's a lot going on. And I think it all commingles and it doesn't, it's not clear.
It's process of elimination.
Yeah.
Because I also had thyroid disease that I'm always like, is this thyroid? Is this perimenopause? Is this menopause now? No, this is actually just your pelvic floor has completely fallen and you need surgery to repair it.
You know what I would say? Stop drinking. Everybody stop drinking so that it doesn't even get convoluted with either hangovers or anything like that too.
Oh, you mean like thyroid disease?
Just in general, get your health together so
that's a whole nother thing.
Sort of a level playing field.
I mean, on that note, I think once you hit menopause, it's so hard to drink. Like your body just does not process it at all. Like even if you want to, there's something physiological, at least for me, and I've seen other women mention this, that their body just isn't processing the alcohol.
Yeah.
So, but no, not abstaining from alcohol is life-changing. We've done a whole episode on that. So anyways, if there's any listeners, as always, that want to leave comments or questions, we welcome them. And feel free to join in on this journey. If this is way too much information, TMI, and you are not interested, we completely understand. But we're putting it out there for the women, that even if it just helps one woman, then this whole episode was worth it. So as always, thank you for listening, and we'll see you next time. Bye.